Initial visits with a healthcare provider during early pregnancy are absolutely critical. What this allows the provider to do is obtain accurate dating, so that if there were any complication that arose later in the pregnancy, the dating is never a question. It will also allow for identification of risk assessment, things such as substance use or abuse, exposure to medications and potential teratogens, the need for any genetic studies as determined by a family history. Also, the identification of pertinent medical and/or surgical history. There also should be a physical exam and then appropriate laboratory testing. And again, a major a major intervention at that time would be prenatal education. We know multiparous women who have no known complications, who have been adequately educated and screened, may actually need fewer prenatal visits, which may actually overall improve their care, provided they're taught the right things to do as far as blood pressure monitoring, maybe urine dips or urinalysis monitoring, and assessment of fetal heart tones. However, in many of our populations that are labeled typically high risk, meaning they have other complications, whether it's maternal or fetal complications, this may not be appropriate. There is current research going on looking at the number of prenatal visits, and could this in some way be reduced to maybe lower overall healthcare costs. And in certain patient populations, there may be potential benefit to this. In a multiparous patient without obstetric or gynecologic complications, and certainly no fetal or otherwise maternal complications, truly a low-risk population, there may be some benefit to this, provided that adequate education is given. Having a mom actually measure her blood pressure, maybe assess her own urine, and monitor her fetal heart tones, particularly early in pregnancy, may be appropriate. However, at later gestations, I think that a lot more comes from a physician visit, where the physician actually can lay eyes on the patient to improve the identification of potential and reduction of risks and complications. I do think there will be some changes in the number of prenatal visits that low-risk women may have. This may be done with the use of technology. You know, we've certainly seen the advent of telemedicine and how it's improved consultation out to the community. And using Skype or another application similar to that, a physician may actually be able to communicate directly with the patient and ask questions and even make visual assessments of a patient using that technology. So definitely, I do think that that may be of some use in the future. However, I think nothing actually replaces a face-to-face visit with your physician. There are many things that occur in prenatal visits, particularly identification of complications and potential risks in the pregnancy. The reason I think this is so important is because early identification is what allows us to modify or to intervene rather, and potentially modify those risks for the patient.